Americans suffer from peripheral arterial disease, and it can impact how you walk, and it's so serious that it can even lead to amputations. Well, we've got an expert here with a lot of detailed information to help you get that relief, because it's now more treatable than ever. And thanks to the amazing doctors at RIA Endovascular, you can now find relief. Take a look. Dr. P, welcome back to Coco once again. We want to start out by talking about the important changes and improvements that you're making in people's lives through interventional radiology. So what kind of procedures are you guys performing?
So interventional radiology is a field of medicine where we perform minimally invasive surgeries. These used to require an open surgery in many cases, but now we can do them mostly through a needle stick, which saves the patient a lot of downtime and pain after the procedure.
Well, it sounds like a lot of benefits are out there in terms of interventional radiology, but let's talk about the specific procedure that you want to dive into today.
Today, I'd like to talk about a condition called Peripheral Arterial Disease. This is narrowings in the arteries that go down to the legs. It's generally caused by hardening of the arteries or atherosclerosis, where the arteries actually get narrowed and so you do not get enough blood flow going down to the legs. Ultimately, this can even cause loss of your leg in the form of an amputation. The risk factors of the condition are smoking, diabetes, high cholesterol, high blood pressure, and age.
Sounds like a lot of folks could be, a candidate for a procedure that you could help them out with here. In terms of really identifying those symptoms, what would we be looking out for?
So the most common symptom of peripheral arterial disease is called claudication. And this is actually pain or cramping in the calf that is brought on by walking and is relieved by rest. And generally the reason people get this is because if you have a blockage in the artery going down your leg, you can't get enough blood flow to that artery or that muscle. And when you walk, you need more blood flow. So sometimes the muscle can actually be starved of oxygen, and that's why it can yell at you a little bit or cramp or get pain when you walk.
Oh, that makes sense. Now, in terms of the diagnosis, you and your team at RIA are really able to isolate this issue and let folks know if you can treat them properly, right?
That's correct. So if someone has this condition called claudication or pain in your calf, you definitely want to talk to your primary care physician. They will talk to you about certain risk factor modification like stopping smoking, getting exercise. There are several medications that can be used, such as cholesterol-lowering medications, aspirin, things like this. But if you continue to have pain in the calf, that's the time to come and see us. What we typically start with is something called an ankle brachial index, which is just where they take your blood pressure in your arm and your blood pressure in your ankle. If your blood pressure in your ankle is lower than your arm, that tells us that you likely have a narrowing in the artery going down to your legs. At that point, we would probably get either an ultrasound, a CAT scan, or an MRI to look at the arteries specifically going down the legs.
And once you get that accurate diagnosis, what's the procedure like here?
So now we are able to perform a minimally invasive procedure to treat peripheral vascular disease. This is called an angiogram, where we actually thread a very tiny catheter into the artery going down to the leg. We can inject contrast or X-ray dye and take pictures as that blood flow goes down the leg. If we see a narrowing, we can treat that with either a balloon to open up the blood flow, or even by placing a stent, which is a metal framework to hold open that artery so that you can get increased blood flow going down to your leg.
Well, tell us what life is like for your patients once they go through this procedure. It's got to feel like such a big relief.
Yes, in many cases it can be. If you remember, a lot of patients have very severe pain at the point that they can't even walk across the room, much less to the grocery store. And what we see is after we do this procedure, even the same day, patients come up to us and are just ecstatic because they can now walk, they can now do exercise. Maybe patients want to get out there and do more exercise, but they just can't because they're in so much pain. So it's really a life-changing procedure.
So Dr. Pete, as we start to wrap up here, tell us how we can get this procedure started and what the first steps are.
Sure. So certainly talking to your primary care physician. But beyond that, you can reach our clinic at 720-493-3406 or reach us online at RIA Endovascular. These procedures can be performed in our outpatient clinic, which I'm actually sitting in now. They can also be performed in the hospital, but they're generally performed as an outpatient, so you go home the same day.
Oh, so convenient. Wonderful. Well, Dr. Peak, thanks for all the info. We'll be checking back in with you very soon.
Thanks for having me.
The doctors at RIA Endovascular are trusted, renowned, and use minimally invasive treatments. If you feel like you're suffering from any of the symptoms related to peripheral arterial disease, give RIA Endovascular a call at 720-493-3406. Learn your treatment options and learn more at riaendovascular.com. They paid for their segment on today's show.